Let's talk a little bit today about autism spectrum disorder and suicidality. First of all, autism spectrum disorder is a developmental disorder that impacts how a person communicates or interacts with other people. Um, you may, if you've been diagnosed with autism, have challenges with social skills, repetitive behaviors, and communication. And it's called a spectrum disorder because it can affect people in different ways and in varying degrees. Some people with autism may have some difficulty with social interactions and communication, and other people may have these very amazing talents and abilities. So let's imagine that our brains are wired differently, like different types of computers. And if you've been diagnosed with autism, your brain is wired in a very unique way that may make it more difficult for you to understand social cues or to express yourself in the same way that others do, which makes it very difficult to navigate social situations and to understand the emotions of others. Empathy may be a challenge for somebody who has been diagnosed with autism. Suicide risks are higher for those who have been diagnosed with autism when we compare them to the general population. Suicidal ideation, attempts, and completed suicides are higher. And this is for a few reasons. Some of the risk factors include, again, the social communication challenges and difficulty expressing emotions and feelings, difficulty sharing what may be happening or having the language to be able to describe what may be happening internally, social isolation and difficulty forming relationships. Just because you've been diagnosed with autism doesn't mean you don't want relationships. It's just harder to develop those relationships and develop those connections with other people. Bullying and social stigma and discrimination can also be a risk factor with respect to suicidality, sensory sensitivities, and even co-occurring mental health conditions such as depression or anxiety. Understanding the intricate relationship between suicidality and autism is really hindered because there's a lack of research in this area, and we have diagnostic overshadowing and communication barriers that occur. So again, we may not be able to conduct a traditional suicide assessment with somebody that has autism, and we have to be a little bit more creative. And I could spend 2 hours discussing how we assess suicidality for somebody with autism, but awareness is key.